Hi, I'm Dr Krishna. I am Clinical Director for Patient.info and also a working GP. We cover a lot of topics in our YouTube channel. This time we've got a new sexual health series where we cover topics such as gonorrhea to chlamydia to herpes. So please stay tuned with us over the next few weeks while we delve into the topics of sexual health. Today we're going to talk about chlamydia. Chlamydia is a sexually transmitted infection. It's caused by a bacteria and it's actually one of the most common sexually transmitted infections in the UK. It is so common that the government and all of NHS want anyone under 25, women or men, tested every year. So what are the symptoms? Well, actually more than half of people don't get symptoms, which is why the government wants everyone checked. But if you do have symptoms, whether male or female, you can get a discharge, which can be yellowy, thin, watery. It can be grey as well sometimes. And you can also get real pain when you're passing your urine. You can feel quite unwell with it. In women, it can cause problems such as bleeding between periods and spotting, and it can cause lower tummy pain as well. So to get it tested, it is a swab. You can do that in a GP surgery. Often we don't have to do that for you. We could give you the swab and you can go behind the curtain into the toilet or whatever and you can do it yourself. You can get at-home testing kits which are free if you're under 25, and you can order them online. They can do them in the safety of your own home. Or you can go to a sexual health clinic and get tested there. Often they're a really good place if you are worried about sexually transmitted infections because they can test the whole load of sexually transmitted infections, whereas in GP practice we can only do a handful. If you find out that you do have chlamydia, it is easy to treat. We can give you some antibiotics and then that can go. We often don't test again to see if it's got rid of, but if you are having more symptoms, then we will probably test again. It's really important to not have sex during this time because you can pass it to each other, especially if you're not finished your antibiotics or you've not been tested before. You will probably have to do what we call contact tracing. So you can contact your previous sexual partners to tell them that you have chlamydia and that they need to get tested. Or if you are, quite shy, quite rightly, a lot of people want to keep their confidentiality. A lot of sexual health clinics will do that contact tracing for you and they'll never know where they got it from. If you don't get treated for chlamydia, it can cause problems with your fertility mainly. So what can happen is that you can get pelvic inflammatory disease, and what that does, apart from chronic pain that can happen in your pelvic area, it can also cause inflammation of your fallopian tubes, and that can cause problems with fertility further down the line. And then what happens is if you do get pregnant, you're at higher risk of ectopic pregnancy, which is a pregnancy outside of the womb, and that can be life-threatening. If you do get pregnant, you're at higher risk of preterm labour or miscarriages, and if you still don't get treated and you do go to full term, that chlamydia can pass on to your baby and it can cause conjunctivitis and problems with eyesight. So it's very, very important that you get tested and treated when you feel like you've got symptoms, or even if you don't. In men, it can also cause problems in their fertility, so into the testes, into the sperm cord. It can cause things like orchitis, epididymitis, and we can give you antibiotics for that too. If you want to know more about chlamydia or anything else, have a look at our Patient.info website, have a look at our social channels, and subscribe to our YouTube channel to learn more. Take care, everyone.